There's new information now about what happened to people in our country, and in particular Gauteng, during the Covid-19 lockdown and the pandemic. Information about how people lost so much income and the impact that it had on them, and the impact it continues to have on them. Gillian Maree is a senior researcher at the Gauteng City Region Observatory. Gillian, good afternoon. You were looking particularly at vulnerable people in Gauteng as the pandemic struck. What did you find?
Correct. Good afternoon, Stephen. Yes. So in this case, we were actually looking at South Africa. It was work done for a report on the impact of the pandemic across South Africa. And really, we were looking at vulnerability in terms of your exposure, as well as your ability to cope to the disaster that came your way. And in South Africa, it's really it reflects a lot of the structural issues and the inequalities that we already have. So it reflects issues around income, race, gender, disability, particular impacts around migrants and refugees, and then also particularly on people who've lacked access to basic services.
There are two sort of numbers and two images I have in my head from this time. The one is the parents who, during the hard lockdown, basically didn't eat themselves to try and make sure they had enough food for their children. And the second is the realization I learned only after COVID that for many years, around a quarter, even more of our children are at risk of growing up stunted because they don't have enough food. Would I be right to think the impact of this time is still being felt?
Yes. So the point is that many of these issues existed before COVID, and what COVID did is exacerbated them and made them acute for many more households. What we know as well is that the impact on wages and employment was the most severe for the most vulnerable. So those low-incoming, low-skilled jobs were more likely to lose their jobs than higher-skilled people. All that put pressure on households, particularly around issues of food security. And the report does go into detail around the impacts on education as well. So not only were these children not getting access to proper nutrition stuck at home, but also there are educational outcomes related to that as well. And that's the real struggle with this. It's not going to disappear as quickly as the regulations around COVID is. It's going to take a long time and a lot of effort to try and deal with many of these existing issues, which have only become more acute for so many more people in the country.
The COVID grant, the increases in the child support grant, did they have an impact at all?
Yes, they did. I don't have the exact statistics with me, but those policies were fairly progressive. So we saw by December 2020, about 40% of the population receiving some form of social assistance, and they certainly do help. I don't think they went nearly far enough. It's just a very small cover for goods. We know the cost of living is increasing, though, so it only takes you so far. And if you're not earning an income, it really doesn't make too much of an impact. But it was progressive in the way that it has been rolled out.
Government was trying to make decisions in real time, very difficult decisions. Did it know enough about what was happening? Was there enough data to allow Cabinet to make the right decision?
Yeah, that's such an interesting point, because we saw so much data coming at us during this time, so many statistics, so many infographics, and the real challenge that we found is not about the data, but what kind of data and our ability to connect different data sets that really makes the difference. So we need information not only on COVID, but we need to be able to connect that to the social systems, to the economic systems, to the spatial planning systems together to be able to make decisions on the fly. And we're making decisions on the fly, particularly at the early stages of the pandemic, not quite knowing what the next stages are going to be. So it certainly did create a lot of challenges. I think the response was fairly good. For somebody who works at that interface of science and policy, I think there was unprecedented access to politicians and decision makers really sitting down, listening to scientists to try and help them plot the way forward. The challenge we have now is how do we create those data sets, make them permanent, make them useful for other things. And as I say, if we want to deal with issues around vulnerability, we've really got to connect data across different silos, so connect our health data to our social data, to our economic data. And that's not just about COVID, it's about any disaster that we're facing in the country. Data is only useful when we can connect the dots and leverage it quickly to make decisions.
Gillian Maree, thank you, Senior Researcher at the Gauteng City Region Observatory.